Hello, Professor. This is Matthew Thompson here, and this is my video over the Genetic Disorder and Mega-Analysis YouTube project. My project is going to be over Huntington's disease, and I hope you all enjoy. So, first thing we're going over is the genetic principles demonstrated by the disorder and disease. So, first thing I want to say is most people with HD or Huntington's disease have an affected parent. The family history can sometimes appear negative for various reasons, even though a parent carries or carried a mutation in the Huntington gene. In rare cases, HD is caused by a new mutation in the HTT gene, which is where this gene disorder comes from. It occurs for the first time in the affected person and is not inherited by a person. As HD is passed through generations, the size of the mutation in the HTT gene often increases. A longer repeat in the HTT gene may cause earlier onset of symptoms. This phenomenon is called anticipation. The next thing we are going over is the list of major phenotypic features. Huntington's disease is an autosomal dominant progressive neurodegenerative disorder with a distinctive phenotype characterized by chorea, dystonia, incoordination, cognitive decline, and behavioral difficulties. This is progressive, selective neural cell loss, and atrophy in the brain. The early symptoms of Huntington's disease include difficulty concentrating, memory lapses, depression, including low mood, a lack of interest in things, and feelings of hopelessness, stumbling and clumsiness, mood swings such as irritability or aggressive behavior. Now, those are pretty common things, not necessarily common things for everyone in all forms, but I think the later symptoms are things that are something that can really tell that you have this disease. So the later symptoms include involuntary jerking or fidgety movements of the limbs and or body, difficulty speaking clearly. Eventually they may find all communication very difficult. Swallowing problems, they may choke on food and get lung infections or like pneumonia from food going in the wrong way. Increasingly low or rigid movements, personality changes, breathing problems, or difficulty moving around. They may eventually lose the ability to walk or sit up by themselves. Next, we're going over the history and physical findings of the case study or of a case study, and I found two that I thought was pretty interesting, or at least something worth putting in here. So there was someone, I don't know their name, but this is a case of late onset Huntington's disease, and what I think is very weird about this is how late the symptoms started in a person, and this was a woman in her 80s with a 5-year history of worsening motor symptoms. So her symptoms started 5 years ago, and it increased the older she got. But again, it's pretty weird that something like this disease happened so late in her age. But her initial symptoms included difficulty walking that progressively worsened alongside presence of choreic movements, involving head bobbing and extreme tremors. There are no symptoms such as numbness or urinary incontinence or memory impairment, and no significant alcohol intake history was elicited. So this is interesting to me because, first of all, she didn't know that if she had any people in her family that had it, so she completely didn't know that this would be something that she could have. That's usually how people know that they might have Huntington is their parents or their grandparents have it, and it's passed through their family tree. But this person, very old, didn't know and learned through, I think she went to a movement disorder clinic, and they figured out that this is something that points towards Huntington's disease. And yeah, that's why one of them, or that's why it was pretty interesting. Another one that I found was interesting was in 1999, this was a case of late onset Huntington's disease with the first symptom of dysphagia. And this was the first time that symptom came with Huntington's disease, so I thought that was pretty cool. The PowerPoint goes over it a little bit more, but I'm not going to go over it just to save time. Next thing we're going over is the background of the disorder or disease. So background, a little information on it. This isn't what the PowerPoint's supposed to be about, but just some background information. Nonetheless, Huntington's disease is incurable. It's adult onset usually. It was named after George Huntington, a physician who described it as a hereditary chorea in 1872. So it wasn't an actual disease back then, but it turned out that this is something that is genetically passed down, and it is an actual disease. So some of the etiology and the pathogenesis of this is Huntington's disease is a neurodegenerative disorder of the brain that is caused by a mutation in the gene which produces a protein called Huntington, which is HTT, as I said before. The mutation is based on the continuous repetition of the trinucleotide CAG, which in turn makes the protein toxic for brain cells. So that's why whenever they do brain scans of Huntington's disease, they usually see shrinkage in areas where this would normally happen. So that's why, or that's how the protein is toxic for brain cells. It would shrink the brain in areas where, I guess, the Huntington gene is, or the Huntington nucleotide is at in the brain. Another thing is Huntington disease affects an estimated 3 to 7 per 100,000 people of European ancestry. An interesting thing is the disorder appears to be less common in some other populations, including people of Japanese, Chinese, and African descent. I thought that was pretty cool. Next thing we're going over is the phenotype and natural history. So this is basically how they tell that you have Huntington's disease. So what they usually do is diagnostic imaging, which is more or less the physician would recommend like brain imaging, or like a CT scan or an MRI, and look at the brain for, like I said, shrinkage of brain cells or brain matter. Just to see whether or not, because that doesn't necessarily tell that it's Huntington's, but you could find other diseases when it comes to that. One of the most effective and accurate methods for Huntington's disease is genetic tests, and that can confirm or rule out the suspected genetic condition, or determine a person's chance of developing or passing a genetic disorder like Huntington's disease. There also can be prenatal testing on a baby before it's born, because if a mother had it and or was passing it along, so that's another way you could tell. Next thing is management. This is how people with Huntington how they treat themselves, or how they cope with it or manage it. There are no treatments that can alter the course of Huntington's disease, but medications can lessen some symptoms of movement and psychiatric disorders. One thing I thought was weird was that if you, for some medications, it can worsen other symptoms. So, medications to treat psychiatric disorders may vary depending on the disorders and symptoms, but also it may cause different disorders themselves. Same thing for the antipsychotic drugs. They might suppress the violent outburst, agitation, and other symptoms of mood disorders, but these drugs may cause different movement disorders themselves. So most of the time, these are just things that you do to suppress the symptoms, but you have to pick and choose with some of them, at least on the later onset type symptoms where they're very difficult to manage, you know what I mean? So they do a lot of like management. And when it comes to antipsychotic, psychotherapy, speech therapy, physical therapy, and occupational therapy can all be tied into this. So a lot of management that comes into dealing with Huntington's disease. The inheritance risk for this is notorious because of how risky it is whenever you have someone that has Huntington's disease. So this gene there's a 50-50% chance of inheriting Huntington's disease. That's why usually whenever you hear it, it's kind of you hear people compare the risk of Huntington's disease to a flip of a coin because it's so common. The backstory on this is we inherit chromosomes from each parent, right? We end up with 2 copies of each of their gene, one from both parent, and researchers discovered that people develop Huntington's disease because of one gene. And in chromosome 4, it is longer than what it normally is. So whenever the chromosomes split between both parents into their offspring, it's half and half. So there is a 50% chance of the inheritance of Huntington's disease. All right, and I think that's everything over this disease. I hope that it was okay. I know it's a little longer than what we were supposed to, but I hope this is okay. Thank you. Have a good day.